Good afternoon. My name is Dr. Kapandula.
And I'm Keegan Joseph.
Today, we just concluded our OSCE exams for our final year medical students here at Lusaka Apex Medical University. So, what are OSCE exams? OSCE exams are objective, structured clinical examinations that are aimed at assessing one's attitude, skill, and knowledge that is based off their clinical experience. So OSCEs are in form of scenarios. These scenarios are in stations and the candidate rotates through these different stations.
Okay, yes, and I'm guessing the big question that you're all having is, why do we do them? So in a nutshell, we have the main recommended are the clinical students. So when they get to their clinical stage, they're posted to their respective hospitals. So this exam is standardized on grounds of, we assess the clinical skills that they've acquired in that time of their practice at the hospitals and wherever they are posted. So with this setup, you ask like, how is it conducted? So the how part, it comes in phases. So like the one we had today we had the physical setup, a physical OSC. So the physical OSC will be divided into, we'll have the manned and then unmanned. So with the manned setup, it comes in forms of stations also. So the manned, you have aid of a consultant, a senior registrar in that particular course, who probe you questions. So for example, a student will be asked questions in line with the topic at hand. Unmanned, on the other hand, is where you might have a printout on a paper assessing on the questions. The questions can vary from the history taking, your clinical examination, your investigation, your management. So in all, it's an exam that's centered at assessing the knowledge acquired and your subjective knowledge that's been acquired also. For example, I'll give you an example in a manned station. You might have a procedure to do with lumbar puncture. Want to assess you on the scale of, if you're on a manned station, the consultant will assess if you know how to introduce yourself, gain consent, and the types of consent as you're explaining about what you're about to do in that procedure. Because the lumbar puncture itself, you just don't do the procedure. So we want to assess you from the start to the finish. In unmanned, the examples that you might have is, for example, you might have diabetes. You want to understand on a pediatric level if you understand the types of diabetes that you have. Yes. So with that being said, you might want to ask a question, where are they done from? So if you can see where we're standing, this is a simulated environment called the skills lab. So you can have them simulated, or you can have them at the same sites, which are the hospitals. So the hospital setup, if it's an OSCE, it can be the same standard. But when you have the MAND, you have examples of an actual patient compared to this one. This one we had simulated, like a simulated environment. But at the hospital, you have an actual patient who you have to either click, summarize a case on, or perform an examination. Yes. So with all that being said, that's just a brief intro about what OSCEs are. So we want to assess and also to know if you're able, your competence, skills, and your levels and attitude towards everything clinical-wise. Thank you.